The phone rings in the plaintiff attorney's office and the caller says, "My husband died of a bloodstream infection in the hospital." From the liability perspective, these are some suggestions for medical record review to determine if there is liability. My name is Pat Iyer. I've been a legal nurse consultant since 1987, and I mentor nurses who want to become legal nurse consultants. First, look at the medical record to see if the healthcare professionals have written the diagnosis of catheter-related sepsis. Second, look to see if there were any blood cultures or catheter tip cultures done. Third, look at the IV insertion sheet to see if there were any. When was the IV put in, and when did the providers first suspect that the patient may have had a septic catheter? It takes a lot of detective work to find out in the chart if there really is a catheter-related sepsis. It's very difficult to determine liability or negligence with a catheter-related infection. The courts are very specific. They want to know how it happened and when it happened, and what is the evidence of those two factors. That's the issue for infections or catheter-related infections. Here are some additional considerations. Once the IV catheter infection was identified, was the appropriate treatment ordered? It's easier to establish liability if the appropriate organism was identified but the incorrect antibiotic was ordered, or an incorrect frequency or dose of antibiotic was ordered. If there was a culture, which antibiotic was the organism sensitive to? How soon was the antibiotic ordered? Did they wait 48 hours? Did they wait 24 hours? Did they start right away? The delay in treatment is always a big issue. Was the patient monitored during the treatment with antibiotics to make sure that they were effective? Was the dose high enough? Was the frequency appropriate? Was it given on time? Get more tips about evaluating liability for IV catheter-related cases by investing in a copy of my book, Analyzing Falls, Pressure Sores, and IV Therapy Cases. Go to the link to order the book on my website, www.patiyer.com. While you're there, sign up to receive our free e-zines and free ebooks, 24 nursing documentation mistakes that could get you sued, 6,500 medical abbreviations, and 275 tips about medical records, a guide for legal nurse consultants. Please subscribe to our YouTube channel and leave a comment below. I'd love to hear from you.